At Dhawale Memorial Hospital Palghar, the Ministry of AYUSH supported Center of Excellence in Research reflects a strong commitment towards scientific rigor and integrative healthcare. Guided by the vision of Dr. Dhawale, the institution recognizes OPDs and IPDs as the true laboratories for clinical research in homeopathy, where patient care and scientific inquiry progress together. Clinical research remains at the core of our approach. Specialized research OPDs have been developed for endocrinology, hypertension, dermatology, respiratory disorders, and mental health conditions, always keeping patient well-being at the center of every initiative. The research work is further strengthened by well-established investigation facilities, including dedicated pathology and radiology departments. A major strength of the center lies in its structured academic and technical support provided to postgraduate residents. They are guided in developing appropriate research methodologies, executing studies systematically and performing statistical analysis using SPSS and R software, thereby enhancing scientific validity and research quality. Over the past 3 years, more than 40 research projects have been successfully completed by faculty members and postgraduate students. Researchers from the institution have presented their work at national and international conclaves, conferences, and academic platforms, receiving recognition awards and CCRH scholarships for high-quality dissertations. As part of its commitment towards capacity building and academic advancement, the institution has conducted more than 25 research workshops across various colleges and universities in India. Through continuous data collection and long-term patient follow-up, with the valuable support of the Ministry of AYUSH, our Center of Excellence continues to contribute to national research systems and strengthening evidence-based homeopathy through innovation, mentorship and dedicated research efforts with the ultimate goal of improving patient care outcomes.